Hello, my name is Monet Lincoln. This presentation is for my MH601 Principles of Healthcare Administration class. It is entitled The Wave of the Future. Change is one thing that is always constant in healthcare. Change takes place yearly, if not monthly, with new laws and advances in technology. Technology has made things easier and faster for not only healthcare but the world. The use of technology has allowed healthcare organizations to improve patient care by better connecting patients with their doctors and doctors to their patients, as well as by making medical treatment advances and reducing costs and creating more profit for healthcare organizations. Today I'll be discussing a company entitled Ringadoc. Ringadoc co-founder Jordan Michaels stated that Ringadoc is a way to improve communication between doctors and patients with the use of technology. Ringadoc is a telecommunications software company that connects patients to their physicians 24 hours a day, 7 days a week. So there's no off days. It also provides automated after-hour answering services that allow for doctors and their companies to triage and provide personal response to their patients. Ringadoc if software allows for healthcare to be provided faster, more cost efficient, and effective, which provides an overall easier experience for both the patients and the physicians. However, in 2014, Ringadoc was acquired by Practice Fusion. This Practice Fusion is a company that is a cloud-based electronic healthcare platform, also known as EHR. This acquisition not only made more advances in telecommunication, but it allowed these two companies to practice and fulfill their mission of providing a connection between the doctors, patients, and data to improve overall healthcare. With the benefits of Ringadoc being convenient, quicker, more efficient, and cost-effective healthcare, there is without a doubt many partnerships available with other existing healthcare organizations. Some of those would include hospitals, healthcare insurance companies, and also just improving the doctor's outreach to allowing doctors to provide care without borders. Borders being just within the small city limits all the way out to possibly internationally. Some examples of hospitals would be when after our late night staff has to deal with a patient in the facility, they may have to reach out to the doctor that was there earlier that day via video conferences or telecommunication in order to make sure the patient is getting the proper care. Another example would be, as seen in a study by Butcher and presented in 2015, it allows for ongoing maintenance care so that it reduces hospital visits for patients who are just needing services now because they haven't been going to their doctor visits on a regular basis. Excuse me. For healthcare insurance companies, this would allow healthcare insurance companies to find lower cost alternatives, such as not going to the doctor but using telecommunication phone calls so that they have over-the-call visits. I personally have experienced this. My healthcare insurance company definitely promotes teledoc, so that is where you call in and you can just give them your symptoms and they talk to you and prescribe you what to do, and your prescription gets sent to the pharmacy just like if you went to the doctor. For me, it not only was it convenient because I was sick and didn't want to leave my house, it was also cheaper. For me, it was only $40, but if I had went to my doctor, it's $100 to even $200. When the terms of rural outreach, this allows doctors to access patients or individuals who have to travel many hours just to see them. This could be in small little cities who the nearest hospital or nearest doctor's office is, 120 plus miles away. This allows them to call in. They don't have to travel those hours to the facility just for a 20-minute visit and stay home and do it in the comfort of their home. A great example of this would be seen in the Sherman et al. Paper, where New York Presbyterian Hospital allows their patients to do their pre-op appointments via web, video, or telephonic means. And this eliminates the travel time. And who wants to travel the day before a surgery just for a 10-minute appointment, just to go back home and then do the same thing again? So it definitely eliminates lots of travel time and allows these doctors to have access to their patients wherever they may be. However, with these great positive attributes of RingDoc, it is definitely a threat to the existing healthcare organization. These organizations that are existing are going to receive possibly a reduce in family practice locations. We're not going to no longer go to the doctor's office, so we're going to be doing virtual means. This is going to reduce the number of practices that are available because they don't have that many patients. When it comes for hospital, there's going to see a decrease in the little minor visits, which may be good, but there's also a little bit of revenue that they are going to be losing. And that same thing goes in terms for urgent cares and minute clinics that are open up. I'm not sure about everyone else, but in my hometown, they're on almost every corner. It was like an instant influx of them, and I feel like with this new movement of telecommunication, they're definitely going to have to close the vast number that they have open. In conclusion, RingDoc is very convenient and useful telecommunication software. Excuse me. As it continues to improve and grow, it will definitely make patient care for doctors and patients more accessible and more easy. Excuse me on that, my finger slipped. And it's just really going to open up the means of healthcare. We're going to see, you can be international and you're going to be able to use this RingDoc to call your doctor and not have to go to an international hospital that you're uncomfortable with. It's also going to definitely reduce the price that healthcare companies are paying out, but add a value at the same time. This is definitely a great product, and with the future of RingDoc and now with its new partner or new owner, Patient Tech, this will definitely be a continued advancement, or Patient Fusion, a continued advancement of care for all, and especially with younger generations who don't want to go to the doctors. This will be a great improvement to their quality of care and quality of life. Thank you so much for tuning in to my presentation. These are just a quick references that I used for this presentation and to learn more about telecommunication healthcare.